Good morning. This is Abhipriya, tutor, physician assistant department, FAHS Meher. And for today's topic, I'm going to take Parkinson's diseases. Introduction. What is Parkinson's disease? It is a disorder of the central nervous system that affects movement, often including tremors. Nerve cell damage in the brain causes dopamine levels to drop, leading to the symptoms of Parkinson's. Parkinson's often starts with a tremor in one hand. Other symptoms are slow movement, stiffness, and loss of balance. The causes of Parkinson's diseases are dopamine loss, genetics, environmental factors, head trauma, age and sex. So what is dopamine loss? Nerve cells in the brain that produce dopamine dies, leading to a decrease in dopamine levels. Dopamine is a chemical that helps the brain coordinate movement. Genetics. In some cases of Parkinson's that are hereditary and a few can be traced to specific genetic variants. However, it's very rare for people to pass on Parkinson's to their children. In environmental factors, exposure to toxins in the environment such as herbicides and pesticides may cause dopamine producing neurons to die. Heating and reusing some cooking oils such as sunflower oil may also cause aldehydes to form, which are toxic chemicals linked to Parkinson's diseases. In head trauma, a history of head injury that resulted in a concussion or head injury with or without loss of consciousness may increase the risk of Parkinson's disease. Other causes were like age, sex, and the risk of Parkinson's disease increase with the age usually starting around age 50 or older. In sex, men are more likely to develop Parkinson's disease than women. Now let's see about the pathophysiology. Destruction of dopaminergic neuronal cells in the substantia nigra in the basal ganglia that leads to the depletion of dopamine stores and that leads to degeneration of the dopaminergic nigrostriatal pathway, and finally it leads to imbalance of acetylcholine and dopamine neurotransmitters in the corpus striatum, and that's then goes to impairment of extrapyramidal tracts controlling complex body movement. Finally it leads to tremors, rigidity, bradykinesia, and postural changes. The clinical features of Parkinson's diseases are trembling of hands, arms, legs, jaw and face, and stiffness of the arms, legs and trunk, slowness of movement and poor balance and coordination. So this is the example of Parkinson's disease. The person with Parkinson's disease represent mask-like face, asymmetric resting tremor, postural instability, shuffling step, freezing rigidity, reduced arm swing, slowed movement, and Parkinsonian gait. Now let's discuss about the staging. Table 1 represent Hyon and Yar scale for staging of PD. In stage 1, unilateral involvement only, usually with minimal or no functional disability. In stage 2, bilateral or midline involvement without impairment of balance. In stage 3, bilateral disease occurs that extends from mild to moderate disability with impaired postural reflexes and physically independent. In stage 4, severely disabling diseases, still able to walk or stand unassisted. In stage 4, confinement to bed or wheelchair unless aided. Now, what are the complications of Parkinson's diseases? And they are thinking difficulties, depression, emotional changes, swallowing, chewing, eating problem, sleep problem, bladder problem, and constipation. Most common treatment for Parkinson's diseases are medical management and surgical management. Now let's see about the medical management. Carbidopa or levodopa that inhibit peripheral decarboxylation, monoamine oxidase A inhibitors, and monoamine oxidase B inhibitors that inhibits dopamine production COMT inhibitors, catechol O methyl transferase. These are all the medical management of Parkinson's disease. The extended version of medical management where in antidepressants, fluoxetine is used, and in dementia, rivastigmine, atypical antipsychotic, and for supportive therapy, physiotherapy and speech therapy is given. Now let's see about the surgical management. Deep brain stimulation. In deep brain stimulation, when we use for people who have Parkinson's diseases for at least 4 years and have motor symptoms that not adequately controlled with medication. So for those people, we'll go for a surgical procedure. Deep brain stimulation is a surgical procedure that treats Parkinson's disease by implanting electrodes in the brain and sending electrical signals to block the symptoms. Steps. Electrode implantation. A neurosurgeon inserts one or more thin insulated wires into the brain through a small opening in the skull. The tip of the electrode is positioned in the targeted area. The extension wire. An insulated wire is passed under the skin of the head, neck, and shoulder to connect the lead to the neurostimulator. Neurostimulator implantation. A small pulse generator like device is implanted under the skin near the collarbone, chest, or abdomen. Electrical stimulation. When the neurostimulator is turned on, it sends high frequency electrical impulses to the brain, which changes the electrical signals that causes Parkinson's symptoms. So DBS can help improve motor symptoms like tremor, rigidity, and slowness of movement. It can also reduce the need for medications and their side effects. However, DBS doesn't cure Parkinson's and doesn't work for everyone. The surgical complication of DBS are similar to other neurological procedures with a serious adverse event rate of 1 to 2%. The risk of infection is about 3 to 5%, and brain hemorrhages can occur in 3.9% of patients. So pallidotomy is a surgical procedure that treats movement disorder like Parkinson's diseases and essential tremor by creating a lesion in the globus pallidus, a part of the brain that controls movement. The surgeon destroys a tiny part of the globus pallidus by creating a scar. This reduces the brain activity in that area. It may help relieve movement symptoms such as tremors and stiffness. In pallidotomy procedure, a surgeon inserts a thin probe into the globus pallidus and heats it to create a lesion that damages a small part of the brain. The purpose of pallidotomy is used to treat movement disorders like Parkinson's diseases, essential tremors, dystonia, hemibalism, and tardive dyskinesia. It can help relieve symptoms like tremors and stiffness. The common side effects are unilateral pallidotomy can cause side effects like problems with language learning, constructional ability, and executive functions. Bilateral pallidotomy is not effective and can have many severe side effects. Other complications include speech difficulties and cognitive decline. A stereotactic thalamotomy is a brain surgery procedure that treats tremors by creating a lesion in the thalamus, a region in the center of the brain. The purpose is treats tremors associated with Parkinsonism or essential tremor. Procedure. A neurosurgeon uses stereotactic technology to identify the target area in the brain, then inserts a probe through a small hole in the skull to create a lesion. Anesthesia. The patient is awake during the procedure, but the area where the tools are inserted is numbed. Recovery. Hospital stay is usually about 2 days and full recovery takes about 6 weeks. Side effects. Common side effects includes confusion, weakness, disturbed speech, and balance problems. More serious side effects include infection, bleeding, and permanent speech or balance problems. Risk of death. The risk of death is very low, that is less than 1%. Thank you.